now present For the Record.
Just ahead, Representative Grothman doubling down on his belief that President Biden is discriminating against white, straight men.
Joe Biden's first 2 years, he appointed out of 97 judges, 3 white heterosexual males.
Plus, a massive deal cut in the state legislature. We are breaking it all down. Welcome to For the Record. I'm Naomi Coles. Some state lawmakers staying skeptical, but a growing number of bipartisan state lawmakers are putting support behind yet another attempt to allow pharmacists in Wisconsin to prescribe birth control. This bill got its first hearing this week after the state's abortion ban went into effect last year. Joining me is Thad Schumacher, owner of Fitchburg Family Pharmacy, to explain how this impacts his industry. Good morning, Thad.
Good morning. How are you?
I am good. So you support this bill. I know you sit on also the State Pharmacy Association. Tell me just the broad strokes of what this bill would accomplish for pharmacists.
Sure. So the bill number is Bill 176, and it is a bill that will allow pharmacists in the state of Wisconsin to prescribe oral contraceptives without a patient going to see a doctor. So in general, this bill is being put forth as a way to provide access to people who would need oral contraceptive care. And so it's important that people have access, especially those people in rural communities that might have long drives to get to a doctor or long wait times to be able to get to a doctor. And we have some studies that show that when people are given a choice of where to get access to oral contraceptives and they have a pharmacy as one of those choices, 74% would seek care through a pharmacy. Pharmacies in general have longer operating hours and more days available for people to go into them. So what would a pharmacist have to do to be able to provide oral contraceptives to people? There would be a screening tool that would include blood pressure monitoring and also a smoking history and some other qualifications. And if the people who are requesting the oral contraceptives were able to meet those criteria, then they would be able to get oral contraceptives through the pharmacist. There is a duty for the pharmacy to notify the patient's primary provider that they received the oral contraceptives through the pharmacy. And in terms of safety, it's important to know that the American College of Obstetricians and Gynecologists, the American Medical Association, and the American Academy of Family Physicians all support pharmacists being able to offer people oral contraceptives at the pharmacy.
Do you think that there is more support behind this bill in the wake of now there being an abortion ban in effect? Do you think there's more support this time around? Obviously, this bill has been introduced before.
Yeah, I believe that there may be some impact on previous decisions by the courts, but I believe that truly it's an access issue. You have people who need these oral contraceptives to reduce their risk of unwanted pregnancy. And there are problems with our healthcare system to access care, especially in primary care level, long wait times. People are unable to get in to see their provider. They may live far away from a provider that could provide oral contraceptives for them. And so I think it's more of an access issue for people.
Understandable. Are there any main misconceptions about this bill or about pharmacists prescribing birth control in general that you'd like to address?
I think that the biggest pushback that I've heard is that it's a risk of safety because people are not going to a physician or a nurse practitioner to get these. But it's important to understand that there'll be protocols being followed by pharmacists that are offering people oral contraceptive care, and those criteria will be met. And the pharmacist will be responsible for making sure that it's safe for people to use.
Thad, thank you so much for taking some time this morning to come on the show. I appreciate it.
You bet. Have a great day.
You too. And coming up this hour, a wild week on a pivotal deal working through the state's top political leaders.